close down. He'll close down the country if one person in our massive bureaucracy says we should close it down.
Vice President Biden, your response.
Simply not true. We ought to be able to walk and chew gum at the same time. We ought to be able to safely open.
And we're fighting it, and we're fighting it hard. There is a spike. There was a spike in Florida, and it's now gone. There was a very big spike in Texas. It's now gone. There was a very big spike in Arizona. It's now gone. And there are some spikes and surges in other places. They will soon be gone.
Here's the truth about that. Over the past week in Florida, there have been an average of 2,986 cases per day, an increase of 26% from the average just 2 weeks earlier. In Texas, at least 99 new coronavirus deaths and 6,426 new cases were reported on October 21st. Over the past week, there have been an average of 5,444 cases per day. That's an increase of 16% from the average 2 weeks earlier. And in the state of Arizona, there have been an average of 898 cases per day over the past week, an increase of 55% from the average 2 weeks earlier, those stats according to the New York Times. Just for 8 months, this has been the approach. It's shocking to see it in the last presidential debate. Effectively, the same case that he's been making since February and March is that it's going to go away. We're going to wish it away. We're rounding the corner. If he closes his eyes and covers his ears, hopefully when he opens them, it will be gone. There's no strategy, and that's the case Joe Biden made last night.
In campaigns past, if Barack Obama or Mitt Romney had done this in 2012, there would have been full-page, front-page articles, not only the New York Times, but Washington Post, Wall Street Journal, USA Today. Everybody would be showing the clips and proving that one of those two candidates lied. Here, Donald Trump lies dozens of times, at least, in a debate. Doesn't get the facts wrong, because that happens sometimes with candidates. He just out and out lies. And it's just become accepted by 45, 46% of the population. It's an extraordinary.
Yeah, and they've just built it in now, right? They've baked it into the cake. This is who he is. What do you want us to do about it? And I would just suggest that learning to live with it is not a strategy. And people are learning to live with it in the short term. They're getting their kids through school online. They're trying to figure out how to make ends meet. But they don't want to do it indefinitely. And the way we're going right now, without a plan, it's headed that way. Let's bring in infectious disease physician and medical director at the Special Pathogens Unit at the Boston University School of Medicine, Dr. Naheed Bhadelia. She's an NBC News and MSNBC medical contributor. Dr. Bhadelia, good to see you. So we've been watching this from sort of the political perspective. I'm curious what you thought watching the debate last night from a medical and a public health perspective.
Well, Willie, good morning. I think that I was hoping at least to get some acknowledgement from the president about the fact that we are at the precipice now of the trend that we've been worried about with the fall and winter. You mentioned the increase in cases. I mean, almost the same number of states, almost 40-something states are reporting increase in hospitalizations, and their increase is not just, we know how this goes. Cases lead to hospitalizations. Hospitalizations lead to deaths. Well, 20-something states are already also reporting increasing deaths over the last 14 days. And so we're in that period that we've been worried about. And when Americans go out today, and during the last 2 weeks before this election, they're making two types of choices. They're making the choices at the polls, but they're also making the choices in their life, in terms of, do I wear a mask or not? Do I go to this crowded indoor gathering or not? And the type of stance the president has continuously taken, saying this will go away. It's confusing part of our population and to the point that they're not being able to, there's already pandemic fatigue, and this is driving home additional confusion that's leading people not to take the steps that they need to take to keep themselves and their families safe. That's the biggest concern. And last night, that type of disinformation that we can just go back to normal, that there will be no consequences, I think is actually driving us closer to having a lockdown, because if we continue down this road and don't buckle down and do the types of steps that, Vice President Biden said, which is balance economic opening with potentially decreasing the cases, then we're rushing headlong closer into scenarios where health systems get overwhelmed and we have to consider more extreme choices, which I hope we never get to. But last night didn't help.